This is a sequence of forearm stretches and self-massage techniques useful for patients with tennis elbow, golfer's elbow, carpal tunnel and diffuse nerve irritation or nerve inflammation symptoms like pins and needles or numbness into the lower section of one or both of the arms. So the first thing that we'll do is identify some of the trigger points in the forearm. The best way to find trigger points through the extensor muscle bulk of the forearm is to position it across your tummy. So if you were sitting down, you just sort of rest it across your midsection. Keep your hand in a thumb up type of position. So that puts that muscle bulk in a nice relaxed position. You then, if I'm doing my right arm, place the left hand over, just dig the thumb in and roll the thumb away. I'll come a little bit closer. So dig the thumb in and roll away so that you're sort of almost using your thumb like a blade to dig into that muscle. So the idea is to find the tender points. So if you get in there, find all those tender points, just spend a couple of minutes working your way across the muscle fibres to break them up. So not up and down, because that's the direction the fibres are running, but we want to mobilise those muscle fibres by moving the thumb across them. So it's almost like a bit of a Chinese burn sort of a movement. You'll save a lot of work for your thumb if you don't try and make it really thummy, if you just get a good grip and then rotate the other forearm so you can really get in there and loosen things up. Okay, so once you've loosened up the extensor muscle bulk, we then turn our attentions to the tricep insertion at the back of the elbow, which is often quite a tender area, and it does contain the ulnar nerve. When the tissues have been inflamed for a period, that impacts on the proper free sliding movement of that nerve from occurring. So to get to that area, pop your arm out straight, make that shape with your hand so that the thumb can be placed underneath the extensor muscle bulk. And the same thing, we use the rotational movement of the wrist to drag the thumb like a blade through that triceps insertion, break all that soft tissue up through there. Same thing, a minute or two depending on how many tender spots you find, completely. Break that all up. Certainly repeat that on the other side. Once you've loosened the muscles off, you're then ready to do a stretch. So the first stretch that we'll do is for the extensor muscle bulk through here. Loosely make a fist, not a tight fist. Clasp the other hand over the top, lock the elbow out straight, pull the wrist under. And the fingertips will naturally pop open as you perform that movement. If you keep rotating the elbow out, tucking the wrist under, you'll maximise the amount of stretch that you get through this muscle bulk. And just hold that for 10 or 15 seconds. So just a nice steady stretch. As the muscle yields, you can overpress a little further. Okay, once that's loosened off, we're then going to stretch the flexor muscle bulk, which is responsible for flexing the wrist. So to do that, to put that on stretch, we're going to straighten the fingers, use the other hand to tuck them under, and then lock the elbow out straight. Gives us a nice even stretch right the way through that flexor forearm. Hold that for a good 10 or 15 seconds. Keep the shoulders and neck nice and relaxed as you're doing that. And just relax your breathing. As you breathe in and out, you feel the muscle release, just overpressure to stretch a little bit further. And once you've done that side, then you can repeat that sequence on the other side. You can repeat the whole sequence a few times throughout the day, particularly if you've done anything that has aggravated your symptoms, and it can help to ease those off a little bit for you. Very good.